So good afternoon, everyone. Thank you for joining us today for our second Lunch and Learn with the AGDN. Today, it is a pleasure to welcome Abbie Fink. She's the Vice President and General Manager of HMA Public Relations and has been with the firm since 1993. Her varied marketing communications background includes skills in media relations, digital communications, social media strategies, special event management, community relations, issues management, crisis communications, and marketing promotions for both the private and public sectors. She serves as HMA's primary media and digital communications trainer. She's conducted training sessions for a variety of organizations, including professional service organizations, nonprofits, government, and trade associations. And she's also received various awards from the Public Relations Society of America and recognition for her community work from the YWCA, Scottsdale Leadership, and the Arizona Woman magazine. So please join me in welcoming Abbie Fink.
Thank you very much for having me this afternoon. And since we are a relatively small group online at the moment, I want you to feel free to interrupt and ask some questions. You can either post them in the chat or just do the little hand waving, or turn yourself on off mute and just interrupt me. We'll make this a little bit more conversational. There is time at the end for some Q&A and maybe some real life examples that we can talk about, but don't hesitate to pop in and offer up some thoughts of your own as we're going through this. So Anna asked me to address today about crisis communications. And I think we can all really relate to this maybe in a way that we hadn't been able to before, based on the last year to 18 months that we've all endured. And really the definition of a crisis, or a crisis that requires some kind of a communications effort, is that thing that happens to us that we weren't prepared for. And there is no doubt that COVID-19, none of us were prepared for. And hopefully the lessons that we learned and the things that we've been implementing, although are valuable, I certainly hope we never have to use them again, because none of us want to have to go through what this was. But really a crisis, in my opinion, is really one of those things that's defined by your own organization, and what actually happens to you may be different than what happens to me when it comes to a crisis. So it's really about the impact that it's going to have on your organization. Is it individually, as a group? Is it something that's going to happen to the whole society, which of course what the pandemic was? But depending on the type of organization you are, a crisis is defined by what impacts you. So for instance, if you are a restaurant and you have someone that has food poisoning, that's a crisis in the restaurant business. That may be less important to a law firm, for instance, right? The likelihood of a food poisoning incident happening at a law firm doesn't impact their business. And so it really is in the eyes of the beholder, if it were, that it's what happens to you and how your organization reacts and is prepared for it. So we consult to organizations, as Anna said in my introduction, across a variety of different industries, professional services, the nonprofit. We do a lot of work in government affairs. We do a lot of work with tribal communities. And one of the things we always talk about is the development of a crisis communications plan, or an issues management plan. They can be used interchangeably. And most organizations will start off by saying, we don't need a plan, nothing's going to happen. Well, as soon as you say that, of course, you need one. And we believe so strongly in it that it is just part of what we do for every organization that we work with. And our best plans are the ones that stay on the shelf, that are, a PDF and a file and never have to be looked at. But you sure as heck want to have one in the event that something happens. And so really, to manage the communications and actually manage the crisis itself is by thinking about it in advance. And what are we going to develop as part of our communications plan, about our crisis plan, that allows us to effectively manage it? I'm going to talk mostly about the communications component of this, because I think once the crisis occurs, Most organizations have a protocol in place, especially I think in the nonprofit and social services world, about what happens and how to respond internally. But we're going to address a little bit of how we communicate through a crisis, and we can address some specifics as we go along. So really the purpose of the crisis plan is to make sure that you have everything in place you need in order to effectively manage what this crisis is going to be. You want to think about what could happen as a result of a crisis. And again, crisis by your own definition. What are the ramifications that could occur on whatever scenario could potentially impact your organization? What is the crisis happening to you, or is the crisis happening as a result of something you have done? Is it an internal issue? Is it something that someone has done to you? Or is it something that is being done to all of us that we're all being forced to respond to? And when you have a plan in place, you are much better prepared to respond and create opportunities for your organization to highlight, if you will, how you're responding to that. Not every crisis has to lead to a negative result. The issue itself is negative, but there are opportunities to positively come out of a particular crisis. I think in particular in the nonprofit sector, if we think about what the last year has been like, if trying to find the silver lining, I think nonprofits saw a tremendous amount of support, both financially, through resources that might not have been available to them before. I know personally, I was much more generous with my contributions in the past year. I gave to a lot more organizations, some very specifically for the role they were playing as it related to COVID, but also recognizing that organizations were still doing the work that they do while also dealing with what was happening over on the other side. So I think that was I'm confident in making that statement that it applied to many people and many organizations. So if the positive of that negative was what else we could do for the organization. But having this plan in place gives you that advanced thinking about what we can do in the event that something does hit our organization. And when we use this plan and we follow the processes that we've put in place, it means we minimize that impact overall. And it allows the organization to continue to do the things it needs to do while dealing with that crisis in its own place. It doesn't have to completely hijack everything that the organization does. You still have things to do. You can still turn around and do other things. One of the things we saw over the past year, and this was across all of our organizations that we work with, very fortunately, and knock on whatever wood and any other superstition you have, all of them survived the past year to 18 months, not necessarily because they had a crisis plan in place, but because they were prepared for something to happen and they knew that they could still operate. They took the time they needed to evaluate where they were at, and they were able to continue daily operations, maybe revised, maybe delivered in a different way, but they were still able to do that. And I would suggest that you could replace crisis communications plan with operational plan, with fundraising plan, with any type of thing, and realize these things apply across any one of your strategic thinking about your organization. So what are some of the best practices when thinking about a crisis or thinking about responding to a crisis? So it may be obvious, but you'd be surprised at how many people don't want to talk about it when it's happening. We all feel the need to fix it ourselves, and maybe if we don't talk about it, it will go away. Well, we know that doesn't happen. And when you have a plan in place and you have your team of individuals that have been brought on to the planning process, dealing with a crisis in itself is not a crisis. You immediately go to your plan and you have that opportunity to think through the processes and what you're going to put into place. One of the recommendations when you're thinking about this is who's going to be the person within your organization to speak publicly. And by publicly, I mean to the media, to your donors, to your constituents, to your recipients, whatever your stakeholders are. Who's the voice of the organization? It may not be your CEO. It may not be your board chair. It may be a communications professional, maybe a programming manager, but think about who that person is and make sure they have as much information as they can possibly have to accurately represent what's happening with this particular instance. You want to set a team. The folks from Esperanza, of course, know we call it the issues management team, and IMT could be a CMT, crisis management team. But you have a small group of individuals within your organization who, as part of their responsibilities, are activated in the event that a crisis occurs. Doesn't mean that they're actually managing the crisis, doesn't mean that they're the spokesperson, but they are the people on your team who you trust to be a part of this crisis team. And I think about up and down your organizational chart. It's not necessarily the chief executive officers or your executive leadership that are the only members of this team. Oftentimes, it is beneficial to have your frontline teams, the ones that are out in the community that might be hearing about the potential issues that are presenting themselves, might be the individual responsible for answering your phones, might be the people on your public relations team, your communications team, certainly someone that handles your social media. These are all people that can be part of your crisis team with that designated person that is responsible for organizing that team. And then finally, the transparency component, right? Think about it just as a consumer. When you watch a television story on the news or you read something in the paper and they say unavailable for comment, the first thing you think of, they're guilty. If they weren't available, they must be hiding something, right? So transparency is key, and transparency externally with your stakeholders, but equally as important is transparency internally. Don't keep this information from your staff. They are your best advocates and the best people to be able to help you manage this. So although it may feel like you need to keep it at the executive level, it is really beneficial to let that be known amongst your organization. Yeah, Anna.
Just a quick question, since we're kind of on the topic. I'm just picturing some of the organizations that are part of our network are smaller organizations with small teams. If you have a situation in that case where you're dealing with a crisis and you're already a small staff, what are the pros and cons or the best practices around? Do you involve the entire staff if you're already a small team, or do you still keep it to a small group of people to manage this?
That's a really good question. And I think the answer lies in the responsibilities of who you have on your team right now. If we're talking small 1 or 2 people, then I think obviously they all, both those individuals would be involved. If you're maybe 10 or less, then you probably do have maybe a department head or a program manager that would be responsible for being on the team, right? To be part of the team. As far as communicating, everyone needs to be involved. The tricky part, I think, is oftentimes with organizations that are that have a volunteer board of directors, is how much information and how much involvement you want your volunteer board to have. And again, I'm not suggesting that they are not looped in, but they are not your decision makers, right? They are, in most cases, are a governing body. They're there to create policy, but it is the staff that has to implement on those. So they should be made aware, but are likely not going to be part of, at least the best practice is, they are not likely to be a part of your response team. They should remain in their role as a volunteer. And that's hard, right? That's hard for the volunteer board chair. That's certainly going to be hard for a volunteer that's involved with your communications to not want to step their foot in it and get involved. But from the staff side, it's managing those expectations. And that comes from that pre-planning, right? That they understand from the beginning what your involvement's going to be. And one of the benefits of being involved in an organization like this, where you have like-minded colleagues at other organizations, is tapping into them for some assistance. you know, you all coming, a colleague from another organization has a sense of objectivity that you wouldn't have from the internal group. And so thinking about who's involved with the network, can you tap into any of those individuals to help you? You know, even if it's just talking through some situations, right? It's an outsider's perspective. They're going to, you know, certainly respect the confidentiality of what you're sharing, and asking them to, you know, just give you some feedback, you know, if you're headed in the right direction, and utilize that. Even if they've never experienced something this as specific as what you're talking about, they can certainly offer an outsider's view, and just give you that kind of ability to bounce some ideas off of as you're planning through this. Anything else right now? All right. So coming from the communications perspective, is really recognizing the role that the external media market can do for us. And one of the things that we help organize, and many of you will likely have these relationships, is when you have a positive relationship with members of the press in advance of any needs, when something like a crisis does occur, you're going to have the benefit of the doubt, and they are going to work with you. Their role is not to, you know, destroy your organization. Their role is to help you evaluate and share information. And so if you have good, positive relationships in advance, both with the media as well as other stakeholders, when something occurs, if something occurs, you've established that goodwill in the community, and are seen as a good corporate community partner, and one that is able to respond quickly when something occurs. So I'm going to pull up a few of these first steps here so we can talk about them in their entirety. So what is your team going to assess when a crisis occurs? So we've already talked about what the crisis team needs to look like, who's going to be on there, and what are the defined roles for these individuals. So again, thinking about who on your staff needs to be involved. May not be the chief executive officer, although if it's a small organization, that person may be the only person. But who else on your team should be part of this discussion? Doesn't mean that they're taking action, doesn't mean they're the ones going to resolve the problem at hand, but they have input. They should be asked what this particular issue is about and how it will impact their organization. What information needs to be talked about, and who else needs to know about it? At what point do you need to communicate that to the rest of the staff? At what point does the crisis need to be shared with your board of directors, your donors, other stakeholders? Do we need to bring in legal counsel? Right? Is it an HR issue? Has there been a report of abuse? Has someone been accused of stealing? Has there been illegal drug use on a mission trip? Do you need to bring in legal counsel to discuss this and be a part of it? Do you need outside, communications counsel? Can you rely on the network or other partner organizations to assist you? Make sure you think about these people in advance and that you have your resources ready to go. The last thing you want in the event of a crisis is to try to find somebody to help you. Doesn't mean you have to have them activated, but you know where to go to when you need them. Who else do you have on within your stakeholder group that you can bring in and be a part of this? If you are impacting, will legislators need to be involved because you might be impacting a community or a different population? Is a program that's being impacted need to notify the donor that's supporting it or the granting organization? So planning ahead lets you think about all these things, right? And then just making those decisions based on the crisis at hand. So one of the things we advise as part of your planning is really developing the what you're going to say and how you're going to say it. And that is from all individuals that are involved with the organization. So If you have someone answering your phones, does that person have a script to follow in the event of a crisis? Have you updated all of your voice messages to accommodate, you know, I'm unavailable right now, I am out of country, whatever, you know, so that they know they're not leaving a message for somebody that's never going to return the phone call. Who's going to be, again, the spokesperson for the organization? And what are we going to be talking about? We have to maintain the business of our organization. It's still important that your daily operations continue. So how do we make this particular discussion distinct and different from what your daily operations are? And then what can you do? And this final bullet point about posting information on your digital assets, so that's your social media, your blogs, your websites. You know, 10 years ago, I didn't have that bullet point because we didn't have our own communications channels the same way. You have a powerful resource in your own assets, your website, your blog, your digital communications to distribute information. And conversely, making sure you're evaluating it and monitoring it to see what's being talked about. A lot of organizations will learn that they're in the midst of a crisis because they found it on Facebook, right? Now, that's not the way to learn that something has happened. You want to be the one managing it. But paying attention to your social assets is important as well when you're in the midst of a crisis or an issue that's becoming a bit more public. I just talked about on our blog this week about how many times you can read or hear about somebody say, man, that organization has a PR problem. Well, the truth is the PR problem is probably a result of an operational crisis that happened that became public and it wasn't managed correctly. So thinking about those things, it doesn't have to become public unless you don't deal with it correctly internally and have your plan in place. So most of us would prefer never to have to talk to the press, but we need to when we're in the midst of something. And I'm going to use media here interchangeably with legitimate interviews where someone from the local television or newspaper has called you and asked you to talk about it, as well as interchangeably with your social media, as well as what you might communicate through your own internal media efforts, newsletters and such, is how are you communicating and what access do these individuals need to have? So think about an operational issue that might occur at one of your volunteer sites. You know, again, thinking about where you might be delivering your service at a school, within an organization, in another country. What access is available there? What are the processes and protocols of that particular organization, and how will they impact what you're doing? You know, we talked about, you know, for instance, if you are delivering service at a school, schools have their own protocol about access, right? They have to check in at the front desk. They have to be badged. You know, they may have to be masked and vaccinated now. We you know, who knows what the processes are, but you have to accommodate those things as well when you are a guest in a different place when a crisis might occur. So managing what is expected of your organization when you are on site is as much a part of the communications effort and as much a part of the managing the crisis as what is actually happening. Anna, you still have your hand up. Did you have another question?
No.
Okay, I didn't want to pass it up. So practicing being a part of you know, the dialogue, knowing what you're going to talk about, having some of your key messages developed. What are the strong points about your organization that you want to make sure are being fulfilled on all instances? And then what are you going to be saying about the specific crisis in the event that you have to speak about it? And my advice is always going to err on the side of transparency, that you are going to want to be available, but that doesn't mean that every part of the crisis needs to be discussed. So for instance, if it's a HR issue, you're not going to discuss the name of the individual at question. You're not going to talk about the specifics of the incident, but you will say, you know, this is an HR issue. We're consulting with our HR team. And when we have more information, we'll be sure to let you know. So you're still available. You're just not giving away all of that information that might be considered more confidential. So I want to talk a little bit about, and well, before I go here, let me pause here on, before we get into now the crisis has passed, to kind of do a little gut check here on, in the pre-planning and in the midst of a crisis, right? So if your organization does not have a crisis plan, does not have a protocol in place, the very basics of getting yourself ready is putting that together. It's thinking through possible scenarios of what could impact your organization and how will you be prepared in the event that it does. And it is every imaginable thing. And again, 2 years ago, pandemic was not on my list of things. It is now. But it's things like financial improprieties, access to materials that are no longer available, interactions between employees that went awry, a donor that didn't fund a program and now you can't deliver that program, car accident happens outside your building, shuts down the power, and you're no longer able to do what you need to do. Something that happens globally that impacts your organization if you're out of the country. Brainstorm, no idea is a bad idea. Whatever is potentially going to happen, put that out there, because it's really going to be in your best interest to think through all of those scenarios. Put that small plan together, who's going to speak, and it may not be by a person's name, it just might be by the title. What are some of our basic responses, and have that in everybody's inbox. It's ready to go in the event that something happens. And keep in mind, in the event that you aren't around, who's your second in command that can take over in the event that you are unable to fulfill the responsibilities on the plan. When you're in the midst of the crisis, that plan becomes your guide. It allows you to go back because everybody has approved it. Everybody understands what's happening. It lets you be flexible because you've got this plan in place, and gives you, as the organization, a bit of a comfort level knowing that you've thought about these things and you have your reactions in place, or your interactions are set, and you know who's supposed to be doing what. So if you can get to that point in the midst of all of that, it's still difficult, it's still challenging, it can still be very upsetting when it happens, but at least you've got your framework and you've got something to go back on. Once the crisis has passed and you have come out on the other side of it, then it's time to do the analysis on how you reacted to it. So what else needs to be done to kind of complete the process? Have we notified everyone that it has been resolved? Have we made all the appropriate changes operationally to ensure that it doesn't happen again? Changed passwords, updated, content on our website, moved banks, whatever it might be, right, to ensure that it doesn't happen again. Has everyone that needs to be notified been notified? And to me, recognizing those on your team that really were valuable helpers in this process, right? Those that stepped up and assisted you. And I'm not talking about throwing a party. I'm talking about the simple thank you for helping us through this. They all want to know that they were appreciated, but really that you are on the other side of it, and that you have made operational changes to mitigate the potential for something like this happening again. You want to convene the group again that was part of your initial issues management team. Determine if they are the right people. Did they react appropriately when called into action? Did we do everything we needed to do? What could we have done differently? What could we improve upon? What do we never want to do again because it's not relevant? What was said about it? Did we externally come out of this in what way? Were the media favorable to us? Were our donors appreciative of the information? How did, kind of do a self-assessment as to what the outcomes were? Update your crisis plan, right? You learned things as a result of going through something, so make those notes and update the plan and save it and send it out again, right? And replace anything that came before it so that everyone goes back to whatever the newest information is in that post review. And it's important here to be very critical of your responses, right? You want to make sure that you look at what you did and determine if you did it correctly. And then I like to go back again in about 6 months and make sure that nothing has changed in that process that we need to update the plan again. Did you move offices? Did you change phone numbers? Did you get rid of, I had plans back in the day that had pagers numbers in them. Well, those aren't relevant anymore. So what have you updated to make sure everything is still accurate and able to be used appropriately? So I want to, if we have time, I want to make sure we have some Q&A. So let me just give you 2 brief examples here of what we've done in the last year, and some of it might sound very familiar to you. But 2 of our nonprofit clients, Excel is a nonprofit school. They work with children and adults with special needs. So of course, when the news came across that COVID was making its way, schools in general were caught very unprepared. Kids were not, did not all have access to the technology for at-home learning. In this particular case, the kids with special needs, many of them have paraprofessionals and other assistants that help them. So there's very close quarters. So social distancing became extremely difficult. Masks and such were not, well, for a lot of people were not comfortable, but for individuals with developmental disabilities and typically have other health challenges, that became even more so. So we had 3 audiences that we were dealing with. We had the students themselves. We had their parents, many of which, for a lot of cases, parents rely on school for 8 hours a day so that they can work and be out in the community and do what they do. And then we had the staff, the teachers and the other professionals that were on campus, all of which required different types of communication. All had very different viewpoints of what was happening, and all were very vocal about what we were trying to implement. And so the learning lesson on this for us was we did not do a great job early on of getting those individuals involved in our decisions. We were taking all the decisions from what was available on a federal basis, right? What the CDC was saying, what the governor was saying, what the superintendent of schools was saying. And we took that as their information, but we did not do a great job of asking our constituents what they needed and how they were reacting. So we learned in very short order a different way of communicating, a different way of bringing in those individuals to help us. They became part of our crisis team. Some had differing opinions about what we wanted to do. But we are now, 14 months past, 15 months past that initial closure. They went back to school a few times and had to go back into a distant learning again. But they are prepared, much better prepared for summer and the fall as a result of that. So, and between all of us here, did not get any attention from the media as a result of anything they did or didn't do. And we were able to continue operations, although in a modified fashion. All the kids still received their personalized education. The adults that participate in the program were still able to go to their job sites and do the work that they do. So although we were impacted, we were still able to carry forth the organization. Financially, the organization, like many nonprofits, saw contributions from new donors and new supporters that were interested in ensuring that kids, and in particular these kids, were able to continue their education. And now we just updated their protocols that include the new information regarding how to manage COVID in your workplace, but how we're communicating. We definitely learned our lessons in terms of looping in more people. And then another example, just for purposes of today, Jewish Family and Children Service. They are a social services agency that does community programming, as well as they have four integrated health clinics across the valley. Like all medical providers, they needed to remain open. They were considered an essential service. People were afraid to go to their doctor, even if they were sick, whether it was COVID symptoms or not, they were afraid to go to the doctor. So our immediate need was, how do we deliver service and to ensure that our constituents stay healthy. So as a result of some very creative fundraising efforts, we were able to launch telehealth within about 4 weeks of the launch. We had a bit of the infrastructure already in place, but we're able to secure some funding to be able to do that. Created an emergency fund very specifically for COVID-related expenses for their constituents. So I lost my job, I can't pay my electric bill, I need $122.57. They gave them the $122.57. We were on track to open 2 new locations. And although the probably smart move, or certainly less stressful move, would have been to delay the opening of those 2 locations, but knowing that the critical impact they were going to have, these services were not available in the markets that we were going to. They were typically in underserved neighborhoods. It would be more detrimental to the neighborhood if we didn't put them there. So after a lot of modification and a lot of discussion with with a team of staff that deliver the health services, as well as our finance team, because we knew what we were going to do was going to have a financial impact. They reevaluated many of their programs, took a lot of them online where they could still offer in person. They did. And again, from a business as usual perspective, continue to operate their programs. And they are on track now to have what will be the 3rd location, or their 5th integrated health clinic, probably within the next 12 months, as a result of not changing their process during this last 18 months. So even with as much knowledge, expertise, planning, experience in doing it, we still had a few bumps in the road and still had a few things we had to change and fix. But again, with the benefit of having a plan in place and a team of individuals willing to take a hard look at what we were doing, those were just 2 examples, but we're able to come out of all of these situations right now in a much stronger position, I think in a very secure position, and we can owe it in part to the pre-planning. Again, pandemic did not live in those documents, but the how we react to things that are happening to us certainly was, and that gave us the benefit of being able to respond quickly. So I think the lesson here for all of us is about really the planning before the incident, and attending a session like this, thinking through it, even knowing you want to learn about it is a great step. You can find lots of resources, really very simply, Google crisis plan or issues management team. There's a lot of resources that are available that talked about, spreadsheets and other things that you can use. But I find, your organization best, the individuals that are on your, within your organization and how they will react. and just bring them in. And I say you because I'm assuming in a lot of roles, you will play that role or be part of those teams. And recognizing the planning, the evaluating after the fact, and then going back and updating. You can't plan for everything, but you will have a plan in place to be able to mitigate whatever might present itself, the unknown, and hopefully the known responses will guide you when you need to do that. So I will stop right now and open it up, and I'm happy to answer any questions or any specific circumstances that might be relevant to your organization, and we can do a little bit of brainstorming together in our 6-7 minutes here that we have left in our talk.
Thank you for all that, Abby. I do have one question that's not necessarily particular to COVID, but more of a general question. So for those organizations that don't have a communication specialist or PR person on staff, based on your experience, what are some of the common pitfalls that some of these organizations can fall into when they don't have a dedicated communications expert?
Sure. And you're talking about in general, not necessarily for crisis, or just in general? Yeah.
Well, I mean, both, I guess.
Okay. So where an organization needs to think about is, in that case, is what is the job descriptions of the people that you do have on your team, right? And so if those are staff members that have certain responsibilities, program delivery, service, fundraising, whatever their tasks are, executive director, CEO, whatever your titles are, does a communications function naturally fit into one of those categories? So oftentimes, I think that responsibility will fall to a development director, your fundraising person, or you may call it a marketing person. That's typically where the communication function would fall if you didn't have a staff person with that title. If you are fortunate enough to have a volunteer board of directors, that might be a position that you engage in from a volunteer perspective. So you would bring in someone like myself or Autumn that does this for a living, but is willing to volunteer with your board, and their responsibility is to guide you in communications. That can come from an agency like what we have, or it can be from a corporate partner. Perhaps you have one of the local banks as a donor, or a law firm as a donor. Well, they may have a public relations or marketing professional on their team, and that might be where their contribution to your organization exists. And in that case, they would be part of those discussions and help you with your communications efforts. Again, whether it's in a crisis or whether it's hopefully in the more positive, proactive way of doing that. And at least in my experience, and this is not only here in the Phoenix market, but our involvement really with PR professionals around the country, around the world, it's a critical part of who we are, which is donating our services. So you should not have difficulty finding someone that would be willing to do that and will take that on as your responsibility. And then they would report into your CEO or whomever manages your board of directors.
That's really helpful. Thank you.
Anything else? Well, I will. I am happy, Anna, if you'd like the PowerPoint, I'm happy to share that with you if you want to share that as well with the recording that will go out. And I encourage any of the members that were unable to attend today, if they want to reach out to you, I'm happy to answer any questions or talk about something that might be specific to their organization. And I'll leave you with sort of the final, which is, these things happen, and the better prepared that we are, the better we are able to respond to them. We shouldn't expect that our organization is not going to have something happen. And again, it's by your own definition of what impacts your organization. using Esperanza as an example, when you were doing your remodel and you couldn't be in your offices, you found a way to still do what you were doing. You found places to work from. You haven't been able to do your medical missions, but you were still able to serve the community. That's a crisis, but it became an issue that you could handle because you figured it out and you had a way to do that. And so, and I suspect that amongst the members of the network, there are many examples of you did this without even realizing you were responding to something because you kind of sprung into action. You did what you needed to do to get it done. It worked, you moved it forward. If it didn't work, you found another solution. That's issues management, right? It's figuring it out and making it happen. What we're suggesting in terms of planning is that anticipation. What kinds of things could possibly happen and how are we going to be able to respond to it? And just knowing that eases a little bit of that stress level when it actually does occur. And staying calm, staying focused, giving yourself the chance to to evaluate. And your gut reactions a lot of times are going to be your best sense of what's right and wrong, and then use that time to go back and make sure that you've protected the organization, you've protected your people, and you'll come out of it stronger with a different kind of plan if and when something were to occur again. So that's crisis planning. I appreciate the time that you all spent with me this afternoon. And again, I'll share the PowerPoint, and if anyone has any additional questions at a later date, you're welcome to reach out. I'd be happy to talk to you again.
Wonderful. Thank you so much, Abbie. We really appreciate your presentation for today.
My pleasure.